Hi, I'm Jason Shane with Shane Physiotherapy here at Moveo Sports and Rehabilitation in North Vancouver. I have Sarah with me today, who's a student from UBC. She's going to be finishing in a couple months. She's your replacement. And today we're going to go through an assessment and treatment for IT band syndrome. So what we're going to check first is my available hip mobility, which is one of the factors that can affect IT band syndrome. So I'm going to get Sarah to measure with this tape measure my ability to push my legs out. She's going to measure from the inside of one of my ankles to the inside of the other ankle. Now, ideal should be between about 45 and 55 centimeters. And what am I?
You are 29.
29. So not the best internal rotation. But we're going to see if we can change that within this treatment. So what we're also going to check is we're going to check and see what the strength is like of my outer glute muscles called glute med, glute min. These muscles are responsible for this movement. They're also muscles that are responsible for side-to-side stability. But what tends to happen is a muscle in the front, a hip flexor called the TFL, can overwork for these. And when that happens, this TFL, which turns into your IT band, if it's excessively tight, it tugs on your IT band and could be what's causing IT band syndrome around your knee. So can you check the strength of this side as well? And you notice I'm keeping my knees squeezed together. I'm going to push this out to the side, and she's going to push in. And where do I feel that? Right here in my hip flexor. And let's check the other side as well. Push in. I feel it right here. I don't feel it in the glutes at all. So what I'm going to do is I'm going to quickly roll both of my TFLs. I'll face this way. And then we're going to recheck and see if that 29 centimeters increase and see if I can feel it in my glutes after. So I'll go like this. I'm going to roll right in here, TFL. It comes off your hip bone. I like to do this method just like this. Use this foot to support. And what I'm going for is I'm going for trying to find a tight spot up in that upper outer hip. Just like that. And I'll move up and down. I'll do it for normally about 30 seconds, but today I'll just do it for about 10 to 15. I'll then switch to the other side. I'll slide it over here, go like this, so we can get a better angle. And what I'm then going to do is, I'm going to roll right along the front of that hip there, and I can control how much force I put on it, or take off of it, by pushing with that leg right there. And I'll do this for about 10 to 15 seconds as well. This is the muscle that gets quite tight. I find when you sit a lot, it also gets quite tight with a lot of running, especially trail running where there's a lot of lateral stability. Okay, I'm going to get up. I'm going to go back and sit on the treatment table, and Sarah's going to reassess, see if it made a difference. $39, so a 10 centimeter increase within treatment. Now, obviously to maintain that, I would have to roll on a regular basis and strengthen these muscles here. And to strengthen those muscles, the simple exercise I give is legs together and push out and in. The last test that we're going to do is Sarah's going to recheck my strength when I push out. My strength is okay, it's will I feel it in a different area other than my TFL. So we're going to put this leg out, I'll get you to push in, and I can now actually start to feel something activating in my outer glutes here. And let's try the other side. And same on this side here, I feel it more in the back. So that would be one of my treatment protocols for treating IT band syndrome. Once again, I'm Jason Shane with Shane Physiotherapy. This is Sarah. If you like these videos and you want to see more, you can like my Facebook page, Shane Physiotherapy, and also Moveo's page, Moveo Sports and Rehabilitation. Thank you very much.